Happy Saturday, everybody. We'll start on a lighter note. I've been receiving some questions about the different ties I'm wearing, and I'm not a person that usually gets too many questions about my clothes, but I thought I would share the story about these ties, with the exception of 3 days that we devoted on the ties to baseball, what should have been opening day. And the blue tie I wore several days ago in regard to Autism Day. What I've been trying to do is wear a tie each day from a separate college or university in Ohio. And one of the great assets that we have is that we're truly blessed with some amazing colleges and universities. And I started off with my two alma maters, Miami University and Ohio Northern. And I've also worn Bowling Green. Many of these schools have different meanings in our family. We've got a large family. Bowling Green tie. My cousin Nick goes to works at Bowling Green for many years. The College of Worcester, where our grandson Albert went, our son Mark, and our late daughter Becky went to the College of Worcester. Ohio State, we have a number of family members who went to Ohio State. Granddaughter Izzy got her undergraduate degree there, and our son Brian got a master's degree, and son-in-law Bill got his PhD there. So Youngstown State, from my good friend Jim Tressel, wore that tie yesterday, and of course that's Amy's alma mater as well. University of Dayton, Ohio University, where my sister-in-law Cindy and her husband Chris went to school. See who else I have missed down here. And today is Neomed, Northeast Ohio Medical University, another one of Amy's alma mater. You brought a scarf from there, I believe, so you can show them that. Anyway, start on a kind of happy note. We're very proud of our universities, and I know this is a tough time for them, tough time for the students, but we're truly blessed in Ohio. It's one of the great assets that we have with our colleges and universities. Mayor Frank Jackson, every morning at 10:30 we have a phone call with many of the mayors around the state. He sent us a video, which I would like to share with everyone. This is a video of the 100th birthday of Louise Williams, and you can see that she has some help in the celebration. You can also see that they're following the social distancing requirements. So we want to thank her friends, her family, City of Cleveland Police Department, Fire Department, and let's roll the video here. Hey, that's fun. That's fun. Now, before I get in trouble going home today, I want to also mention that Fran was a graduate of Miami University, 4 of our children, and we have 4 grandchildren there right now. So don't want to forget them. Let me talk about our hashtag. You want to put that up there? Hashtag In This Together Ohio, and hashtag Stay at Home Ohio. If you search for these logos on Facebook, you can find the frames and uplift them to your profile picture to show your support. So there they are. Pretty cool. We spent a good part of the day so far working on hospital build-out as well as the procurement. We have a great team that's working on procuring many of the things that we need to get ready for this wave that is coming at us. I want to give a shout out to everyone who is working on that today and tomorrow and every day. I want to also thank very, very much the many businesses, manufacturers that are trying to quickly get in the game and help us. These are Ohio companies and help us produce some of the things that need to be produced. So I want to thank them very much. The chart that I've asked Eric to put up has to do with the hospital build-out. And let me just talk a little bit about that, because this is something that we work on every single day. And you heard a little bit from General Harris yesterday. There's really three ways that we're trying to get more capacity in our hospitals. One is cut down on the elective surgeries. And what that has done, of course, is it's freed a lot of rooms up in our hospitals. So we've gained some space that way. Second is the build-out, the physical build-out that General Harris was talking about yesterday. And I know that he and his team have been out from National Guard to look at many sites, and that is a work in progress. And we'll have more about that next week as we talk about where this build-out is actually going to occur in the different regions. But the third, and was what this chart shows, is that hospitals themselves are creating additional rooms. They're finding ways to build out literally inside their own campus, inside their own buildings. So what this chart shows is the increase that's already taken place. It's already taken place just because of internally what the hospitals have done. So thanks to all the hospitals, thanks for all of you who are working on this and making a big difference. Let me take a moment to, we thank a lot of people who do a lot of different things and who represent us and do some very, very tough work. I want to, first of all, start off with kind of a shout out to those of you who work in our prisons. We appreciate very, very much what you do and want to thank you for that. Appreciate what you do every day, but also during this coronavirus challenge that we are facing. Let me also do a little shout out to those who are on, other people who are on the front line that we don't talk about too much either. And these are the dedicated Ohioans who make up the vital health and human services safety net. Thank you. Thank you for providing the programs, the care, the shelter, the home visits to Ohioans with mental illness, Ohioans with addiction, developmental and intellectual disabilities. Thank you for what you do. Your service is too often unsung. Today we pause to let you know that we see what you're doing. We're grateful for your service. And so on behalf of everyone that you serve and the families of those that you serve, we thank you very, very much for that. About 15 minutes ago, I signed an order in regard to expanding telehealth. I'd already issued one order in regard to this, and the whole idea is that during this time when we need to stay away from each other, legally allowing more work to be done in the health area because from distance contacts is what we really need to do. We are certainly today doing things differently. We want to ensure that people are caring for themselves both mentally and physically. Since most non-essential doctor's appointments have been postponed, telehealth services are being more widely utilized every day. We want to ensure that those who see providers for not just their physical health, but also for their mental health, behavioral health are able to access care as well. So this executive order has to do with broadening that ability. Today, I signed an executive order that will effectively allow Ohioans to more easily access telehealth services from individual counselors, social workers, and marriage and family counselors. Normally, to utilize telehealth services, you must have had a face-to-face first meeting, and counselors and social workers would be required to take special training in providing telehealth services. The order that I signed today will enable those requirements to be removed so patients can be more readily seen, and we break down that barrier today. Mental health is truly just as important as physical health. It is part of our physical health. And in this time of social distancing and stay-at-home orders, we're trying to ensure that those who need these services can get them. They can access them without leaving their homes. Let me talk a little bit about masks that have been very much in the news. Yesterday, as you may have heard, we have a new advisory from the CDC in regard to the wearing of masks. And I know Dr. Acton will talk about this in a moment. Today, as every day when you're seeing this, there's only 4 people in this room. Eric and Lieutenant Governor and Dr. Acton. But for those days that I am in public, I intend to wear one of these masks. These are some that Fran has made, and some other ones that she's made. But you can see 95 masks. They're not what the medical community wears. But I think we should look at them as something that we can do that should be socially acceptable. In fact, when we see someone with a mask like this, whether it's in the grocery store or wherever it is, I think what we should think is they're trying to do something that's good. They're trying to keep their germs. They're trying to keep from infecting us. And so these are positive things. Dr. Acton will explain the limitations to them. What we don't want is people to think that this is a substitute for social distancing. It is not, but it is something that certainly we can do and should be accepted. And if we see someone, whether they're working in a grocery store or wherever they're working, or we just see them outside, we ought to think, hey, they're trying to do something positive. And we're not going to require these to be worn. I'll wear one of the ones that Fran made when I'm out in public. Let me just add a couple things on that. We mentioned the N95 masks, the ones that the medical community wears that provide the very significant protection. Again, we would encourage, John talked about this yesterday, but we had a great breakthrough over the weekend. Battelle is now every single day is sterilizing these. They have agreed to do this for nothing for a couple weeks. So every hospital out there, we would just encourage you, bring them in. This has a multiplier effect. This means that we can use these up to 20 different times. You'll be able to use them up to 20 times, bringing them in each time to get them sterilized by Battelle. So it's a major breakthrough in Ohio. We are also we're working frankly this morning on procuring more of these, buying more of these, and our goal is to get as many in here as quickly as we can so that we can provide this help. And I know a number of people in the medical community, some of you working in nursing homes, maybe in other positions, need these, you want these, and we're going to do whatever we can to try to get these in to you as quick as we can. And when we start getting them in, we will be announcing that as we move forward. So again, I would just finally say in regard to the mask, we encourage employers, if you have someone in your employ who wants to wear one of these, we would just encourage you to say that's a great idea, and that's a good thing. Lieutenant Governor.
Thank you very much, Governor. Love what you had to say about the masks. I know around our household, we know we're being very careful. Tina, when she goes out and shops her one time a week, she wears a mask and gloves into the store, and we appreciate when we see people in these stores, in the places, wearing the mask, because they're trying to do us all a favor. This is not something we should be scared about. It's just something that in society, it actually shows respect for one another, that we're trying to do our best to slow the spread. It's just like that. I mean, it's working, because that hospital statistic you showed earlier, if we hadn't slowed the spread, that capacity in the hospital system would not have been built, and we would not have been able to handle this. So by slowing it down, everybody's doing their part so that the system can catch up, and literally, you know, in it all together, Ohio is the truth. A couple things that I want to mention today. First of all, Wi-Fi hotspots. We know that around the state that there are places where people don't have great internet access. Maybe sometimes you don't have it at all, or it's very spotty. This is really important, as we know students are out there maybe trying to upload or download homework assignments, turn things in. Businesses, people from working at home may have to go somewhere to find a hotspot to be able to do their work. And so we have a website, which is coronavirus.ohio.gov, under Business Help, and it's under the Individuals and Families tab. Now, I understand the irony of this, that we have a website for people who do not have great internet access, and we understand that you may have to leave home to go get access to it, but we also understand how important it is, because this will show, this is a map with all the hot spots around the state, something that may be local in your community that you can use and take access, have access to. It helps people who are maybe using their own hotspot on their phone, who are burning through their data. It's going to cost them a lot. We know technology use is up. These might help you account for those costs and that data usage that you're doing. You may have really slow internet access, and this will help you speed that up so that you can get the files that you need. And it also may help you. You may have a hotspot you're going to. It may be a distance from your home. This will help give you easier access to those things, maybe make life a little bit more convenient. So let me repeat again. It's under coronavirus.ohio.gov/business help, and it's under the Individuals and Family tab on that website. And, you know, I was thinking about this, a couple other things. For internet service providers, if you look at that and you have hotspots that are not on there, then we want you to give them to us so we can post them and get them out there for folks. You can do that together at governor.ohio.gov. Again, internet service providers, let us know if you have hotspots. We're not listing it together at governor.ohio.gov. And I was thinking, as we're thinking tomorrow, we want people in churches to practice social distancing, not have service if possible. This may be a great tool for you to go go in your car, go to a hotspot, and take part in church service from a distance, either on Facebook or YouTube or however your church might be providing access to that service. Additionally, always want to do these reminders, things that you can do in your spare time. Voting. April the 28th is Election Day. We're only going to have we're only going to have by mail voting, no in-person voting. You'll have to request an absentee ballot. You can do that at voteohio.gov or by calling your local Board of Elections, voteohio.gov, or going to your local election board, calling them, I should say, and requesting that. Also, census, 2020 census.gov. We need people to fill out their census forms and get those in. Very helpful as well. Additionally, a couple other things, reminders, coronavirus.ohio.gov/job search. We have grocery stores, medical providers, people who are desperately in need of a workforce. I know people are losing their jobs, but we need to make sure that we get that information out there for people who might want to go help out during this difficult time. 23,000 jobs as of today that are posted at coronavirus.ohio.gov/job-search. And do appreciate all the feedback we're getting from small businesses about the usefulness of the tools we're providing. Did a call with them this morning. Very, very helpful. And then two kind of, I didn't wear a tie today, and I don't have my alma mater on here, but I do want to give a shout out to a couple people at my alma mater, the University of Dayton. Coach Anthony Grant, who was named Coach of the Year in college basketball, and Obi Toppin, who was named Player of the Year in college basketball. Two great things that happened to our UD Flyers out there for just another success story here in the state of Ohio. And then finally, one of the people that did a video for us, Chris Spielman, he has been auctioning off his paraphernalia, his Big Ten championship ring and things like that. He's trying to raise $40,000 for coronavirus. These are the kinds of selfless things that people are doing to try to go out and help, be part of the solution. And there's so many people doing wonderful things. So if you're a Buckeyes fan, you're looking for maybe some things to buy that would make you have some great memories about Ohio State football. Chris is auctioning some of those things off, and the money's going to go to coronavirus aid. And so we just appreciate how everybody's pitching in together to try to help support the frontline workers and everybody who's in need. So we appreciate all that selflessness that's going on out there across Ohio. Governor?
Lieutenant Governor, thank you very much. We now have Ursel McElroy, who is our director of the Ohio Department of Aging. She's on Skype from her home, I believe. Oh, there you are. Hey, Director.
Hi. Hi. Hi, Governor. How are you today?
You want to give us a little report on what we're doing with your department and the folks that you serve?
Absolutely. So thank you, Governor, and thanks to everyone watching today. We know that across Ohio we have 2.8 million older adults, along with them family members, friends, and loved ones who are all trying to make sense of this very difficult time. But I'm reminded that older Ohioans bring great strength and wisdom and calm, especially during times of trouble. And they tell us we've never seen anything like COVID-19. None of us have, which is why we so appreciate the leadership of you, Governor, Lieutenant Governor, and Dr. Atkins. But we know this fight is not just about leadership. It's about every individual Ohioan. And we cannot stress enough how as Ohioans we must all pull together to do all that we can to keep each other healthy, especially our older adults. By now, we know that COVID, for older adults, they are in the high-risk group, especially those with additional chronic medical conditions. But we are pleased that industries are stepping forward, hospitals are working together, state agencies are working hard, and I can assure you the Aging Network is poised and continuing to prepare to help our older Ohioans. So my department has focused its efforts on maintaining essential care for older Ohioans during this time. And these resources include help with things such as hygiene, administering medications, and ensuring access to meals and personal care services. Now, in some cases, we're quite aware that the precautions have created other concerns for older people. For example, how do you get food if you're told to stay home? How do you receive the care you need from loved ones if no one can visit you? How do you protect yourself when you're in a facility? Other residents may have been exposed to COVID-19. In anticipation of these complications, we're continuing to develop and deliver solutions because we understand that along with the preservation of life is the quality of life. And we know this is hard, preserving life while balancing our need to live life. Each of us, we're taking it day by day, and sacrifices are being made. Many of you are caring for yourselves and caring for and worried about loved ones on so many levels. So for everyone watching, let's remember to keep an eye out on our older adults, both for their care needs and also because they're setting the example of what all of us should be doing. Their years have brought wisdom and resilience and patience and bravery. But we also need to appreciate how hard this is for our loved ones who are living with perhaps Alzheimer's or a form of dementia. They may not understand the changes in their daily routine, and daily routines are so important to them. I would encourage you to reach out to your local Alzheimer's Association as they have people ready to help you. I want to turn to meals because food access is essential to maintaining the health, mental function, and well-being of all of us. We've been working with our partners to make it easier to get meals delivered to older adults who need them. The demand for home-delivered meals has increased as we expected it to do, due to the recommendation for older adults to stay home and also due to the closures of congregate sites throughout the state. The Department of Aging has worked hard to receive additional supplemental funding from the federal government. Just this week, we were able to push out an additional $8.8 million across the state to help to meet the growing demand. This in addition to the resources we already have on the ground. But we also anticipate much more relief is coming in the near weeks. The meals support the nutritious needs of many older adults and may be the only meal that they consume the entire day. And so for those of you who are listening today, if you need a meal, if you know someone who would benefit from having a meal, we certainly encourage you to contact one of our area agencies on aging. And that number is 866-243-5678. And this information will be available at coronavirus.ohio.gov. And around meals, I want to send our appreciation and thanks to the home delivered meal providers, from the food distributors to the food preparers to the volunteers. We are so grateful for the work you're doing because we appreciate the uptick in the demand right now. And for anyone who wants to assist, whether being a home delivered meal provider, if perhaps you can help with delivery, if you could send donations, we will certainly make that information available to you as well on coronavirus.ohio.gov. And now I want to talk about living, our living arrangements across the state and how they are impacting older adults, particularly during COVID-19. We have nursing homes. We have nearly 1,000 nursing homes in Ohio with approximately 90,000 beds. We also have 755 assisted living facilities with about 62,000 beds. And we also have independent living, about 70,000 older Ohioans living in affordable housing communities. And you can see that the commonality here is that these are all congregate settings. And so we've had to put in place measures to ensure the safety of the residents within all of these settings. With our nursing facilities, we discontinued visitation unless it was an essential individual or worker in the facility, or we do have exceptions for end of life. The same applies for our assisted living. And with our independent living settings, we are certainly encouraging that in those communal entrances and where those congregate settings are, that we limit the back and forth in those places as well. But I want to encourage you to know that along with the limitations that we put in place, we've also encouraged our workers within the facility to help to keep people connected with their families and friends and loved ones. We're doing this by a variety of ways. Sometimes we're able to do it by email, by notes, by letters, by phone calls, and by video chat. And so we certainly encourage you to still stay in contact because we do understand how important contact is, both for the individuals and their loved ones who care for them. And I want to thank the facilities and the tireless workers. This is a large group of workers to whom we are so grateful. This is to the nursing homes, to the assisted living facilities, and other senior housing. We know this is the hardest thing you've likely experienced in your work lives. And so we thank you for all that you are doing in this space. I want to turn to personal services and transportation. In Ohio, we provide care for nearly 55,000 older adults in home and community-based settings each day, those with high needs and perhaps limited income. Personal care remains one of the most critical and most requested services we have during this time. And we've worked to make our programs and services more responsive to your needs while focusing on physical distancing to keep people safe. We've put steps in place to make it easier to access our services, whether you've had our services before or not. And I really want to make sure that I bring that point home. Whether you've had our services before or this is the first time, we certainly encourage you to take advantage of what we have to offer you during this period. And you can access those services well through your local area agency on aging. It's important, while I am here today, to address yet another group, and that is our caregivers. I want to talk a bit about our caregivers and also to our caregivers. What we understand is that caring for a loved one can be very hard work, especially during times of an emergency. But caring for yourself is important, and it will benefit your loved one. Whether you are new to caregiving due to the crisis we're in now, or you've been a caregiver for years, you can always benefit from self-care. And just know that the federal government, through the Corona Aid, Relief, and Economic Security Act of the CARES Act, provides for additional funding for family caregiver support. And Ohio will deploy that assistance to our network once it becomes available. We also, as a department, we have developed resources for caregivers that we have placed on the coronavirus.ohio.gov website. And certainly we encourage you to take advantage of those resources. They give you tips on things such as self-care, precautions to take during this emergency, and some basic emergency planning. This leads me to give a thank you yet to one more large group, and that's our in-home care workers, our transportation workers, and yet again, our family caregivers. I want to extend our understanding and our grateful appreciation to you for all that you do. We value you in everything that you're doing. We appreciate everything that you're doing to keep yourself safe, but also those out in the community that otherwise would not have the support that they need. Words are not enough for us to say thank you. So how can you help as an Ohioan? Well, I'm asked that question oftentimes. First, call people regularly. Keep in touch. Contact is so important during this time. We do not want individuals to feel isolated at all. Ask simple things like, what are you doing? What have you watched on TV? What are you reading? Again, passing notes, sending letters. All of these things make a difference. Ask if they need help with groceries and supplies. We all want to be there for one another. As we've said again and again, we're all in this together. And finally, in closing, again, I want to thank the governor, Lieutenant Governor, Dr. Axton, for this opportunity just to talk with you about some of the things that we are doing and how we will get through this together. We feel very energized. We are very committed and very dedicated to this. And so, again, I just want to thank you for the time here today. Thank you, sir.
Director, thank you very, very much. We appreciate it. Thanks for all you do. Great. Dr. Acton.
Thank you, Governor. Thank you so much, Director McElroy, Ursel. It's just such an honor to work alongside her. There's nobody who's been more passionate about helping our aging population, and she happens to also hail from Youngstown, so we have that in common too. And I do want to thank you. I am wearing the pin from NeoMed. It used to be called NeoUCOM. It's where I went to medical school. Really a big part of saving my life. I worked 3 jobs in undergrad at Youngstown State, but I was able to afford going. It's an amazing program. You also sent a scarf, which is lovely, and I'm not that fashionable. My daughter was very committed to getting me on what not to wear at one point in my life, so someday I'll learn to wear the scarf in the right way. but I thank you for sending that, and thank you, Ursel. You're a pretty amazing person. I have a lot I want to share with you today. You know, we try to be lighthearted because we want to stay connected. I also have some serious things to talk about today. So let's go ahead and start with the data. First of all, at this point, we are at 3,739 cases as of this morning. And I'm sorry to share that we have 102 deaths here in Ohio. I'd like to go to the next page and just show you again our dashboard. It has those age ranges, again, about equal male-female, and showing that we have, in fact, tested 41,000 tests have been run in Ohio at this point. Next slide, please. So this is new today. This is responding to our media. I have so much more to share, more numbers with the media. The governor shared something about our hospital increase in capacity. I want you to know that there is a ton of action. We're sitting here in a very quiet state house sharing this with you. Behind us is just an incredible array of activity taking place. And next week, I'm committed to sharing more of the numbers with you because we've had teams working nonstop to put that together for you, but also more of the stories from the front lines, because I know it's very hard for us to talk about things and you not see them, but behind us, there's so much happening. So this is the beginning of some of our death data breakdown, and it's very hard. Again, we still don't have a lot of numbers. I've told you that deaths really lag behind becoming infected and being hospitalized, and deaths are sort of a very later in time way to measure the impact of this virus on Ohio. But what we do know now, I do want to share with you, again, we know that the elderly are the most vulnerable. Of those hospitalized, it's really going across all ages. We certainly see deaths being much more likely in people, again, who are at risk and elderly. But I do want to point out, we are seeing some of the deaths in younger people and people who did not have pre-existing conditions. We will have more and more understanding of this. You can't take these numbers yet and say this is what it will be the story for Ohio all along. There's just too few to make that kind of judgment yet. But it is data that we're following along with a wide variety of other measures, and we'll be sharing more with you in the week to come. Next, our curve. We will also be talking a lot more about the fact that you are being successful, Ohio. And one of the things that is keeping me up at night is when I say we're being successful and we're not seeing yet, that's why I want to bring you more of the stories from the front line. When we're not seeing, maybe telling our story here, standing here, of what our hospital providers are facing, I want you to know that we are flattening that curve, but we can't let up. The only weapon we've had is slowing this down, and Ohio has done an amazing job. And we are seeing that this is continuing to flatten, which is giving our hospitals a little more time each day. But I want to talk about masks in a little bit, and I want you to know that masks are going to be in addition to what we're doing. They are not to be done instead of what we're doing. It's very, very important because it can give us a false sense of security, but it's so important that we use this as another tool, not in substitute. Next slide. So this is fascinating. This is the beginning of some of our data on how our social distancing is working. We have proxies. There's no exact way to measure what we are doing, Governor, to stay at home. But our models are very based on our behaviors. And this is where you and I, are changing this hurricane from a Category 5 to Category 3. So here are some of the things we can look at. This is Google data that shows a little bit about our mobility changes, but we also have data from traffic. Like, we can actually look at traffic patterns in Ohio, and there's cell phone data that is looked at. Now remember, this isn't your individual personal data. I know this is a touchy subject for a lot of us, but it is like aggregate data and usage, and it is so fascinating because we can see in Ohio, the decrease we're making on retail by being out, we're actually doing more retail delivered, which is exactly what we want to see. We can also see a decrease in general transit. But what we see is an increase. Look at this increase in our parks. So we're using those more. And we can see an increase in activity at home. These are all measures, they're proxy measures for how well we are doing this, staying at home and taking this seriously in Ohio. There's a fascinating map out there that was in the New York Times that shows the whole country by things like transit and by cell phone usage, and you can really see the collective Midwest impact, which is priceless, priceless to show that what we're doing together is making a difference. So I'd like to talk a little bit now about masks. We are talking, we're going to have a video on our website, we have some links already about how to make a mask. Remember, this mask is not to make you bulletproof. It isn't going to make you bulletproof. A virus can get through any homemade mask. It is this very hard to get rare N95 mask. This is the fitted hospital grade that we need to conserve for our healthcare workers. And honestly, the surgical masks as well, the very simple rectangles that aren't fitted. If you have those, as I said, keep 1 or 2 for yourself, but get those to your local health department, your local EMA, or to a nursing home nearby you, because they are running dangerously low and need those. The culture shift that's about to occur is about this one. This was General Harris's wife made this, and I get to be the lucky person to wear this one. We are gonna have videos on how to make them. It's really important. Certain fabrics are better than others that are thicker. You don't want to be able to see the light through the fabric you choose. There are ways to make it without sewing. For those of us who can't quite remember from home ec how to thread everything, there are tips and tricks to all of this. But this is for us to wear to protect other people, knowing that many of us are asymptomatic. Dr. Redfield from the CDC has been saying some studies are showing that up to 25% of people may never even know they had this. And it is that group, and it's those of us before we get sick. Remember, a number of us will get very sick, stay at home, but won't be hospitalized. When we're out and about going to the store, wearing this can make a difference in us spreading those respiratory droplets to other people. Again, it's not 100%. It's about 80% effective, but that 80%, like our Swiss cheese layers of everything we're doing to stay home, adds up collectively to slowing down the spread of this virus, buying us time, precious time. And so I want to encourage folks to wear this. I know it's a culture change. One of the reasons we've said not to go out and buy masks and wear it is because we knew that, one, people needed to get the very rare amount of these out to healthcare workers. Also, it's just recently studies have shown that this can make a difference. But there are instructions on washing your face, washing your hands before you use it, because you can actually contaminate your mask. So you want to read those instructions on coronavirus.ohio.gov. But our hashtag in this Together Ohio is a great place to show what you're doing with this. It's a culture change, but Ohio, we have changed culture on a dime. I know Ohio could lead the way in doing this. I want you to send your pictures out. I want you to tweet those out and get those out. It's a lot to ask for us to go to something that in Asian countries and other places around the world, it's actually seen as cool and hip and the polite thing to do. And this is a change for us in our country. But it's something that I think we can all do together that will make a tremendous, tremendous difference. So I need your help, Ohio. I need you to wear both the cape and the mask now. You're definitely a mask crusader to help protect each other. It's beautiful weather, and I need you to understand we are fighting for lives right now trying to procure stuff like this. It is basically forcing our whole world to fight for a precious amount of these. Our hospitals are fighting. We're fighting to get testing equipment. We're fighting to get these made. We're fighting to find ways. We have these amazing manufacturers here in Ohio. But it is a war against time. It will be a while, and this is a long haul. So everything you can do to help us preserve these is going to make a difference. And I'm going to continue this dialogue next week about how we can collectively work together. Thank you so much, but please don your cape, and when you're out and about, don your mask. Thank you.
We'll be happy to take some questions. Again, for those of you who are at home, we continue to be in this separate room, also in the Capitol. In a much bigger room in the annex are the reporters, and there you can't see them, but they're walking up one at a time, keeping their distance apart. They're really spread out and over a very big room.
Hi, I'm Laura Hancock, and I'm with Cleveland.com. This question is for Governor DeWine. In your most recent stay-at-home order, there were restrictions against campgrounds under a lot of situations, pools, day camps. Are you expecting this to go into the summer? A lot of these are summertime activities.
Well, we don't know. We've extended the order to May 1st. We think there's virtually no chance that we would, be in a position where we could stop the order before May 1st. We'll see where we go. I don't think we really know beyond that date. I mean, you've heard Dr. Acton explain what the modelers are telling her. We continue to have dialogue with the different modelers about when they think this is coming, when the biggest hit. So we really do not know. But we want to cover those just in case anyone was doing them before the school year, the normal school year would have ended, and we got into summer. So we didn't know whether any of those activities would have been taking place in April. Your point is well taken. Some of those traditionally are, when summer hits, and we move into those then.
Thank you.
Thank you.
Good afternoon, Governor. Jeff Reddick from ABC 6 News here in Columbus. Question for Dr. Acton. We've had, I believe, now nearly around 42,000 people tested in the state, which means majority are coming back negative. Do you view that as a good sign? I know we're not talking a lot about negative cases, but wanted to see if that's positive.
Right. So, those numbers are still morphing as well. In terms of we still don't have enough of our population to know what that means, but we do know that most people who are going to be tested are going to be negative. Sometimes they're negative, unfortunately, early in the symptoms, so then they become positive. Our hospitals are working on putting together some numbers for us of the positivity that they're seeing from the testing in their hospitals. Early on, some of our testing data was a lot more open. We also have a team that's working on some surveillance, a CDC team that's coming in to work in our rural areas where we know we're not getting testing data. And then we're actually going to go do a small sample of the general population. I think that will help us understand a better picture of who is truly positive. Remember, it's spreading and doubling. What I see in our negative data is that we're slowing this down. We're slowing down the spread. But I think there are more subtleties around what we're seeing in our hospitals with our testing data, and I'll share that with you on Monday. So the good news is we know it's going to spread. This is no vaccine available. Most of the population is at risk of catching this sooner or later. But what we're seeing is we're keeping that spread slow in Ohio, and that's a good thing.
Thank you.
Thank you.
Governor Noah Blundo with Hannah News Service. Early in your administration, you expressed an interest in considering licensing hospitals by the state, and I'm wondering how this experience, now that you've been immersed in hospital operations and emergency planning for weeks, how this has affected your thinking.
Okay, I apologize. I could not hear everything you're saying. You said early in the administration.
Early in your administration, you expressed an interest in having the state license hospitals, and I'm wondering boy, how you feel about that today, given you're being immersed in hospital operations and emergency planning for the last few weeks.
Well, I don't know that my opinion has changed. I mean, we are focused on an emergency, so, you know, we're probably not doing this at this point. I'll defer to Dr. Acton. She and I have discussed this before, and see if she has any additional comments.
So I do. Licensing sounds like one big cover-all, and it isn't. Licensing is actually a very productive conversation we are already having with our hospitals, and it is something that we'll be looking at collectively. I want to say that the hospitals in our state are doing just the most outstanding job. The way we will use something like licensing is really more a conversation mostly about the positive things we want to share together, like good data. Those are the sorts of things that will be part of that discussion, and those will go on. But I can tell you, I just want to make it clear, I can't say enough. I mean, I will not cry right here on this camera, but what I see these folks doing across competing sectors for all of our health. Next week, I'll be talking to you about your individual patient journey and how you will engage with your healthcare system. When it is all said and done, I think one of the many, many heroes in Ohio will be our hospital system. And so licensing, absolutely, and I know what you're referring to. You're referring to some of the bad situations we had seen in a couple hospitals. But the licensing conversation is so much more. What it is about is making our healthcare system and our public health system work together in more effective ways. And that is definitely a dialogue that we are all excited to continue beyond this. Thank you.
Hi, Whitney Harding from NBC4. My question is for Dr. Acton, but I would also like to hear Governor DeWine's thoughts on this as well. Unfortunately, during times of crisis, people take advantage of fear and panic. I've seen in one of our neighboring states that there were fake drive-up testing centers happening in most particularly the poorer parts of town. My question for you, Dr. Acton, is what can people in Ohio look for if they see something like this and know it's not real, it's not true, because these people were taking health insurance information, DNA swabs. I mean, that's very scary. So what advice would you give? And then, like I said, Governor DeWine, if you have thoughts, I'd like to hear them as well.
I think all three of us have some very strong feelings about this. And first of all, if anyone hears of something like this, please let us know right away. It's a travesty of this time. You know, most people are rising to the occasion and doing acts that I'll never forget for the rest of my life. And there are people in all different spheres right now who are taking advantage of the situation. It's really important at home to know that you should be getting, no one can get tested right now in Ohio without the help of their physician or primary care person. Maybe it's a nurse practitioner. So you will be referred for testing. And unfortunately, most people who are outpatient aren't being tested right now. So please know, unless you've been given very specific instructions about how to be tested, which most likely will be involving a hospital system or a site that they have set up that is not given out to the public at large. It's done through going through the patient medical record. Don't let anyone take advantage of you that way. There are numerous scams going on right now, and we have to be hyper vigilant, some of which I hope we're highlighting on our website. We'll share those, but it is unfortunate. It's also unfortunate that, you know, we're being pitted against each other to buy things right now. And there are a lot, for as many great offers, there's also a lot of really false offers out there. And that's one of the reasons it's been so hard for us to give you exact numbers, because even as the state, we're having to weed through what is sort of a free-for-all out there. Really, really, really be careful out there, folks, and we'll try to get you good information when we hear of these scams. Governor and Lieutenant Governor.
Well, my experience has been that in crisis, Ohioans usually rise to the occasion, whether it's a tornado, whether it's a flood, bad fire, whatever it is. You see neighbors coming in, you see total strangers coming in to help. It's also, unfortunately, been my experience that there's just a small minority of people who are scam artists, and they just use that as an opportunity. They were scam artists before. They're still scam artists. They'll always be scam artists, probably. And they come in and they want to prey on people. So, as Dr. Acton said, if any of you see that out there, let us know, because we want to broadcast that. And I know the news media wants to broadcast that and say, look out for this scam.
Yeah. If I could add to that, there are lots of scams that are going on, trying to hide, pretending like you're an employment agency to get somebody's employment data, trying to sell things that they try to scam us for a lot of times for buying these masks that aren't true. There are all kinds of those things going on, and people who violate trust at a time like this are particularly a bad group of people. And they should be turned over to law enforcement. Let the Attorney General's office know. I know Dave Yost, who's our Attorney General, would want to get on this kind of stuff right away, and also make sure your local health department, local officials know, so that they can intervene as well. This is just violating this trust during a time like this is an especially cruel thing to do.
Thank you all three. And real quick, Dr. Acton, I want to be clear for people watching or listening. If you find one of these places and they don't ask for your information from your doctor that you're allowed to be tested, that's probably your red flag right there, correct?
I think so. That would be the red flag I would use. Absolutely.
Thank you.
Thank you.
Hi there, Maury Givens with Spectrum News 1. This question is for the Lieutenant Governor. We've been following unemployment over the past couple of weeks, really. We've been dealing with the calls with JFS, and I know that they're working as hard as they can. But what do we say to these Ohioans that, they're sending us emails, they're calling us, they're saying they're feeling lied to because they feel like they were told that this was going to roll out, these programs were going to roll out, they were going to get money a lot quicker than, the weeks or maybe even months that it seems like it could be. And then I also want to know, are we going to hit a surge in these unemployment claims that's going to be unmanageable by the state?
Well, you used the term surge, and for unemployment, the surge happened immediately. With healthcare, the surge is yet to come. With unemployment benefits, the surge hit immediately. The Director of Job and Family Services, Kim Hall, and her team have added 20 times the capacity on the tech side and are adding hundreds of people to the call center. By next week, they will have grown the size of the call center by 1,000 people to try to serve these folks as fast as they can. The call center is open today. It will be open tomorrow from 9 to 1. And we encourage you to use the website 24 hours a day. Well, let me finish. And so that's what's been built out. We know it's not where it needs to be. Now there are and they continue to improve. The wait times continue to go down. I'm looking at the analytics on this, and it continues to get better, but it's still not where we want it to be. So they're going to continue to do this. I hope we will be in much better place by next time, or by next week, particularly to the end of the week when we get all of the staff trained and on board that we need to be. I was on a call with lieutenant governors from around the country this week. I know that all the states are facing this issue, but let me be clear on one aspect of this. With independent businesses, 1099 employees, people like that, we do not even have the direction from the federal government on how to set up that program yet. That is weeks away. The program, the CARE Act included money for it, but it gave no mechanism for the distribution of that money. So that has to be built from scratch to make sure that we have a distribution to qualify people and a distribution system to get that money to them. So we have engaged the private sector in it. We're building that system, but we still don't even have the guidance from the federal government yet as to how we're supposed to onload those people to the system and how we're supposed to get the money out. But we're building it, waiting for their guidance, literally, as we speak.
And I think people understand that. They understand the time. They understand that this is all new. But as time goes on, people are still waiting. If we're talking about months to get this new system put up, or even weeks to get some of the other changes that could be handled by the current system, what should people do? What can people do? How can they manage?
Yeah. their eligibility, even if it takes them a couple days to get through, their eligibility, whatever they're eligible for, will be backdated to the point that they were eligible. So they will continue to get, they will get all the benefits that they're entitled to through the system. We have seen dramatic improvement over the past week with this. We expect to see dramatic improvement over the next week. And I am very empathetic to their situation. That's why it's something that we are daily engaged at improving to serve them, because I know that people out there are worried and scared and are facing these challenges. That's why we've put into law that someone can't be evicted. We've given mortgage relief. We've given insurance relief. All of these things trying to hit, for the most part, a 90-day pause on all of that until the system can catch up to support them in a way that that's needed for them. So we are very, very committed to making sure that they're taken care of. But what the unemployment system is for those folks is different from this other group of people. And I want to be clear that we are building a system right now that we haven't even been given guidance from the federal government on how it needs to be built, but we're getting it ready anyway, and that will be out a while. So that's going to require patience.
Thank you, Lieutenant Governor.
Hi, it's Karen Counselor from Ohio Public Radio and Television State House News Bureau. This question is for the governor. Governors in other states have gone to great lengths to get PPE, personal protective equipment, from China and to stop it from being seized when it arrives. Are you working on securing PPE from international or other sources, or are we just relying on Ohio manufacturers and businesses to manufacture and donate it?
No, we're going after it wherever we can find it. There should be a plane coming in Tuesday with the first shipment, and we'll notify you when that comes in. I was working with our team this morning about securing other shipments, so we are on it. It's very, very important, and when we get big loads in, we're going to notify the news media and let you all know. Look, our goal, and it's aspirational, and we certainly are not there yet, but we want to make sure that this personal protection equipment is there for everyone that needs it in the state of Ohio. I see the concern. I hear the concern from the folks who are on the front line, whether they are first responders, EMS, whether they work in a hospital, and I get it. I understand. And so we are working on two fronts for a lot of this personal protection equipment. One is trying to get some of it manufactured here, but we're not waiting for that. We're moving ahead, and we're going to go buy it wherever we can buy it, and we will keep you informed as that comes in. It's not going to get here overnight, but as soon as we get it in, we're getting it out. It will be going out into the field to people who need it every single day.
Are you concerned it might get seized?
I'm sorry?
Are you concerned that there might be an attempt to seize any of these shipments as they come in?
Well, that's right. We've heard the horror stories. We know the horror stories about it being seized. And we've had conversations with our hospitals who have told us horror stories. So yes, that is a concern. And we are very concerned about that. But we're not just going one pathway. We're not just going one source. We're going multiple sources. You know, there's a real sense of urgency, and I can guarantee you that everybody that works for me, works with me, gets my sense of urgency, and they have that sense of urgency too, because they understand this is a matter of life and death for the people who are out there who we rely on every single day. We understand how important this is. You know, we get messages from doctors and nurses who are wearing the same mask all day, and that's not the normal protocol at all. We're seeing people at the front line who don't have these. So it's a very, very serious thing.
Thank you.
Hi, Rick Ruan from the Columbus Dispatch. We've heard both Governor DeWine and Dr. Acton talk about the hard work that's going into preparing for this surge, expanding the capacity of healthcare facilities, things like that, but we haven't really seen data yet on the number of hospital beds that we can expect at that point. We haven't heard about an inventory of ventilators, I believe. What's the status on that? Do you guys have that data yet, and what can you share?
Look, we've told you that we believe we need to double the number of hospital beds. There's been significant beds created in the sense of hospitals that are not doing elective surgery. That's an order that we issued some time ago. That has had a benefit. We showed you a chart a little while ago that showed the increase that hospitals by themselves have been able to obtain internally. So those two things have occurred. What now is occurring is the third step in regard to those beds, and that is the build-out. And you're going to start seeing, well, you've already seen mayors go out with the National Guard around the state, look at different sites. So we're going to continue to inform you of where those sites are going to be. And basically, with maybe some exceptions, we're not looking at constructing new facilities. What we're looking at doing is taking existing facilities and putting beds and all the other things that are necessary in those facilities. So that is a work in progress that is occurring right now. But we've said all along, our goal is to double the number of beds. We have started down that pathway for the first two things I talked about. Now we're on to the third part, and we will continue to do that. And again, we thank every Ohioan for giving us the time to do it, because we can't do this overnight. As far as all the other things that we're trying to acquire, one of the things that we are in the process of doing is taking a full inventory. Now you might say, well, why you have to take an inventory? Don't you know what you have? Well, we've got hundreds and hundreds of hospitals. We've got hundreds and hundreds of nursing homes. And we've got many, many first responders. So trying to get an inventory of all the different things that we have out there is important. It's a work in progress. We're getting close to having that. We're getting that from the hospitals, and we'll be in a position to, share exactly where we are on that inventory at some time in the not too distant future.
Have you set a deadline for the hospitals to report that information to you?
Well, with me, it's everything was yesterday. So, we're in a hurry. We've told them we need it. We told them we want it right away. But it's not just the hospitals. I mean, if you're looking at personal protection equipment, trying to get a read on that, it's nursing homes. It can be first responders. It can be many different places. So, trying to come up with that inventory takes a little time. But we're not waiting for the inventory. At the same time we're taking the inventory, we're pushing ahead. And when we get hard information about exactly when we expect things to be online, come in, we will certainly share that with you, and we'll continue to do that in these daily press conferences.
Thank you.
Hi, Governor. Eric Halpern with NBC4. Yesterday, you had mentioned the Ohio Food Banks Association and the emergency funding request there for the $25 million. I was talking to them earlier today, and obviously that's still an issue for them across the state. Any update on if and when they could see some help?
I'm sorry, I missed the first part. Who'd you mention?
The Ohio Food Banks Association.
Yeah, that's 24 hours ago. So yeah, we're working on it. We understand the sense of urgency. Look, we get it. There's nothing more important than food, and we want to make sure that everyone in the state is in fact covered. So it is a priority. I don't have an update for you today, but we will.
What would your message be? Because something I'm hearing from them is the fact that because some of the grocery stores are so strapped with people stocking up on stuff, that's then impacting the food banks and what they can provide. So what would your message be to Ohioans given that?
Well, our message is the food's going to be there. The grocery stores have made it very clear they're not running out of food. They've got a good supply chain. The supply chain is just as solid, just as good as it ever was. And people need have enough at home, and if you might want to make sure you got enough for 14 days in case you get sick. But you don't need to hoard it. You don't need to have large quantities of, we've seen stories of people walking out with just tons of toilet paper and other things. So I think, look, we're all in this together. We have to take care of each other, and part of taking care of each other is making sure that we're not actually become hoarders and take more than we really need for our family within a reasonable period of time. But look, feeding Ohioans and making sure Ohioans have the food they need is a priority. It has to be a priority. When we when we closed the schools, first thing we did is we went right to the Trump administration and said, look, we got feeding programs in these schools. These kids are not going to be in these schools. We want to have the ability legally to take this food out to them. In one community, it goes out by bus. Other communities, they have spots that people can pick up the food. So food is a top priority with us, and we get it. We understand.
Thank you.
Hi again, Laura Hancock from Cleveland.com. I'm just circling around to a question, or to something that Dr. Acton previously said. Dr. Acton, you had said that a team of CDC workers were going into rural Ohio to try to do like an overall population estimate of who might have it. I was just wondering when you expected that work to be completed and when those results would be released, and then what is going on for like the non-rural parts of Ohio?
Thank you, Laura. So we're in negotiation with the CDC right now. They reached out to us at the end of the week to talk about sending a team to look at rates, particularly in some of the rural regions of Ohio, a lot in southeast along the river, and then a little bit northwest, and some in Amish country as well. This is a team of scientists that will work alongside our scientists. I've heard, it's not in writing yet, so I still have to get the proposal in writing, but that the CDC Foundation is looking at actually funding and extending their stay here. So they'll be part of that army. But there's much more to this. I'll have more details to announce in probably about a week. But we're working on standing up a team of amateur epidemiologists alongside some technology. The thing that we need in our hands is enough testing, so we might just start with a random sample of 100 innocent, asymptomatic people. You'll find out who you are. But we're trying to get a better sense of who's out there, a better sense of what's going on in the general population. Remember, right now we're focusing all our scarce testing on the sickest. So all of that is part of strategies. If you want a little hint at it, Massachusetts governor released some work that they were doing with Partners in Health. We've also talked to some of those same people. We're using some models being used around the world, but we're also going to be using some ingenuity of our scientists right here. So I'll have more, and I know it's so hard. Back to the gentleman from the dispatch. We are not hiding numbers of ventilators or anything. I cannot tell you how absolutely difficult. I know other states are throwing out numbers. They're not of the accuracy and usefulness that I want to use to drive our work here. So we have data teams that have been working around the clock. We had some old clunky hardware, this is just truth again, to track stuff like this, and it just wasn't robust enough for a pandemic of this size. So we got together with the hospitals, with my team, to build new software to track things differently. We're tracking things that have never been tracked before, and it's much more complicated than it sounds, and we want to use the best data. But we have things coming out next week. I'll just give you a short little list of things to come, and there'll be more. And anything I have, I'm going to make it publicly available. But we are looking, first of all, we're already seeing some trends in hospitals about how long people stay. That will be very interesting to share. We're looking inventory across the state, not just at any one facility, and we're looking at it regionally because we're going to be moving stuff around within regions. So what one hospital has is not always going to be the best indicator. We're looking at it across a couple areas. We're looking at COVID suspect and COVID positive census, because right now we can get census data from hospitals, but it doesn't tell us who has COVID or not. And then there are people who have been tested, but the test result isn't back yet. So they don't register. They register as pneumonia and not COVID. And so there's tricks to all this data. We've changed the way we register deaths in Ohio for COVID, so that's changing. We're looking at people on vents and in the ICU. We're looking at all sorts of patient demographics, clinical course of patients. So there's a list upon list of everybody's wished for data that we're putting together. We also did this huge inventory of CPAP machines, ventilators, anesthesia machines that were out in ambulatory settings. All of them are being sort of barcoded, so to speak. So, because if we take it from somebody, we want to be able to give it back. There's just this whole system that we are building in the middle of a pandemic. So none of this is us not wanting to tell you what is out there. It is us trying to honestly get our arms around the most accurate numbers. But the cheat sheet on all of this is we've known for a while that we need to double and to know that we had enough. And so that's where we're building at the same time as we're assessing. And some of that will also drive, quite honestly, what we need to buy. So we really want smart numbers, not just guesses on some of it. So thank you for your patience. Next week's a big week. We'll be talking about our regional system more, how those hospitals are working together. But mostly, I want to talk to people about what it means for them. And just a little peek into that. What you will do when you're sick is what you normally would do. You will talk to the same providers and you will go to the same hospitals. Our air traffic control of moving you to someplace different, we're going to take care of all that piece across our regions. We're going to help direct you. But for the average person at home, do what you've always done if you're sick. And if you're sick right now, I want to say one more thing. Most of us can stay at home, and you're starting to see, I don't know if anyone watched Chris Cuomo, Anderson Cooper piece last night. The newscaster himself is sick, and he's been chronicling his journey. It feels very, but you can you can be at home and be well, and then all of a sudden have trouble breathing. So I really want people, the second they feel that their symptoms are worsening, if you are having trouble breathing, even though your doctor has talked to you about staying at home, I want you to call right away or call your emergency room and call to go there right away, because we see that people can get worse quickly. But you go through those same hospitals. Don't worry about what we're doing behind the scenes. We're building whole new airports and traffic control. But for you at home, keep going through your regular routes. And if you don't have help, then go straight to your hospital, your emergency room for help. Thank you.
I just have a quick follow-up. With the population testing, will it be the state effort, will that be separate from the federal effort?
It's really hard to divorce those because we work, we're funded, 75% of my funding actually comes from the feds. So, our epidemiologists are working alongside the CDC. I basically have a CDC inside my state agency and work with locals. There are numerous population-based things that will be happening. All of them depend, quite honestly, on the testing and ultimately serologic testing. So you'll be seeing huge efforts underway. We're going to be doing tons with the CDC, but we're also going to do some of our own work with our researchers and talent right here in state. So stay tuned.
Thank you.
Mm-hmm.
That was our last question.
Well, 4 weekends ago, was supposed to be the Arnold Classic. And that was the first big decision that we had to make in regard to distancing. It was a very, very tough decision. Looking back 4 weeks ago, it looks like an easy decision, but it certainly was not. But I want to give a real shout out to Mayor Ginther, who was our partner in that, who went through that. He never flinched. He did what he thought was right. Very difficult thing for a mayor to do. So, Mayor, thank you for doing that. Thank you for being with us on that. And I want to give a shout out to all the mayors, all the county commissioners, mayors throughout the state, police departments, chiefs, sheriffs, who have been with us throughout that and who now have the burden of enforcing some of these orders that we've been issuing. So I'm very, very grateful for that work. This is the 27th, I'm told, 27th straight day We've had a press conference. The goal is not to have one tomorrow. I think we said that last Sunday and the previous Sunday, and we ended up having to come in. But we do not intend to be here tomorrow unless something comes up where we have to get a message to the people of the state of Ohio, or have something that simply has to be discussed as far as some sort of breaking news. Tomorrow is Palm Sunday, and so we wish everyone a joyous Palm Sunday, those of the Christian faith. For those of us who are Christian, it marks the historic the entrance of Jesus into the city of Jerusalem. It begins Holy Week, which is a week of very mixed emotions, the death, but also a week of hope. And it is very, very important to those of us who are Christian. And it's going to be a different Palm Sunday. We're not going to be gathering in our churches. It's just going to be very different. Like no Sunday, no Palm Sunday or any other Sunday that any of us really can remember, except for the last few Sundays that have been so very, very different. So again, I would just urge everyone to be careful. Observe Palm Sunday, observe that day in your own way with your church in spirit, either on the radio or on the internet or however you do it. But please do not gather together. This is much, much too dangerous for any of us to be doing. Holy Week is a week of hope with Easter coming up. I thought we would end. This is a picture from the Grafton Farm, which is near Steubenville, with the sign out there that says, "We will prevail." So some Ohioans put that up, and it's I think, indicative of the spirit of all Ohioans, no matter what religion, that we will make it, we will prevail. So we will see you back here Monday at 2 o'clock. We hope you all have a good weekend. Thank you very much.
And we've been watching Governor Mike DeWine and his team give us an update on the coronavirus here in the state of Ohio. We've now confirmed 3,739 cases here in the state of Ohio. We have 102 deaths, 1,006 people hospitalized. We also know that more than 41,000 people have been tested for coronavirus. The CDC now recommending cloth masks in situations where social distancing might be more difficult, like at the grocery store on this Saturday, April 4th. Now, NBC4's Eric Halpern was there at the State House, and he's joining us now live with what we're learning from the situation here. Eric?
Well, Mark, as you just mentioned, we've been hearing a lot about masks on both the national level and the state level. Now, yesterday, as you mentioned, the CDC put out those recommendations for people to wear masks when they're out and about, and we heard something similar from the governor and Dr. Amy Acton today. The governor said he is going to be wearing one when he's out in public now, one that Fran DeWine made. And now, to be clear, this is not about those N95 masks that are so needed for those frontline workers at hospitals and nursing homes and other medical facilities. This is some of those other masks you've seen, maybe some of those homemade fabric ones. Dr. Acton held it up at today's press conference and says she is encouraging people to wear these masks when they're out and about, but she wants people to know that this is not to be instead of all these other social distancing practicing that we've been doing. This is an additional measure of safety to help prevent spreading of germs.
So I need your help, Ohio. I need you to wear both the cape and the mask now. You're definitely a mask crusader to help protect each other. It's beautiful weather, and I need you to understand we are fighting for lives right now trying to procure stuff like this. It is basically forcing our whole world to fight for a precious amount of these. Our hospitals are fighting. We're fighting to get testing equipment. We're fighting to get these made. We're fighting to find ways. We have these amazing manufacturers here in Ohio. But it is a war against time. It will be a while, and this is a long haul.
And the governor did mention one new executive order that he signed today. It has to do with telehealth. This is the second order having to do with telehealth that he's signed in this fight in this pandemic. This one now expands access to telehealth when it comes to individual counselors, social workers, family and marriage counselors, emphasizing that mental health is just as important as physical health. Local feed at the State House. I'm Eric Halperin, NBC4.
Right, Eric, thank you. And the governor ending that press conference on a positive note with the message, "We will prevail." For the latest on the coronavirus, you can head to NBC4i.com or join me here tonight on NBC4 at 6. We now return you, though, to regularly scheduled programming.